Hello. Hi. I'm from HOA. Mr. Khilnani doesn't need any introduction. He's got 40 years of experience in pulmonology, and here we are with him to talk about the effects of vaping and the people consuming dry tobacco. So here's Mr. Khilnani. Sir, to start with, what led to you specialize in pulmonology?
So if I could give an honest answer, I joined Department of Medicine at the All India Institute of Medical Sciences in 1991, and I got in touch with my mentor, late Professor J.N. Pandey, who was one of the finest respiratory physician. And soon enough, I worked in the field of health effects of air pollution. I was so impressed with his clinical equipment and his respiratory and critical care medicine that I took it as a career and continued working starting from 1991 uh, till today. So that is my interest in. Otherwise, I am basically.
At what age did you start your profession? Like, at what age did you really get into it?
I was 36
Okay.
when I was already done MD, and I was 6 years practicing, and
Okay.
then I came to the.
Okay. Okay. So now getting into what are the common lung conditions you treat?
So, in India, the most common condition that we treat is starting from asthma, COPD, tuberculosis, and now increasing incidence of lung cancer also. Besides this, being a tertiary care center, we also treat diseases like interstitial lung disease, which is becoming more and more common, diseases like sarcoidosis. But if you ask about the numbers, then asthma, COPD, and tuberculosis are most common diseases that we see.
Okay. And how does COPD impact patients' quality of life? And what management strategies do you recommend?
So, COPD, chronic obstructive pulmonary disease, as on today, it is the third leading cause of death all over the world,
Okay.
and it also becoming, in some states, second leading cause of death. COPD is used to be almost exclusively caused by tobacco smoking all over the world. When I was studying, 90% of the COPD was because of the tobacco smoking. But as on today in India, 40 to 50% of COPD is caused by atmospheric air pollution, both indoor and outdoor. Also, it is caused by industrial exposure to noxious fumes. It is also caused by post tubercular lung fibrosis and sequelae. The question that you asked, Prateek, is how does it affect patient's life?
Right.
Unfortunately, COPD is a preventable disease, but once it occurs,
Right.
it is progressive,
Okay.
and no treatment except quitting tobacco or avoiding exposure to the pollution
Mm-hmm.
improves the outcome.
Oh.
So the patient, to start with, they start getting cough, early morning cough,
Mm-hmm.
which they take it as normal,
Okay.
and then as the time progresses, and this time is over the period of years, not months,
Months. Right.
they start feeling breathlessness on exertion, they start wheezing, they have to sit up at night, and next step is that they'll end up in emergency with what we call as exacerbation of COPD, or they come with pneumonia. They sometimes are in, quite often they are in the ICU and ventilators, and that is why it is third leading cause of death. And these patients also have more chances of heart problems also.
Okay. A very common thing these days it's going on. Like, why are more men involved into vaping, like e-cigarettes? Is it a fashion symbol or what is it?
So, Pratik, you need to understand what is e-cigarette. And what is cigarette? Cigarette is you know grown substance called
Tobacco.
which contains nicotine.
Right.
So when you chew tobacco or you inhale tobacco by cigarettes or bidi or hookah or chillum or whatever, the nicotine goes into your blood
Lungs.
through the lung. It goes into the blood
Blood.
and it gives a kick.
Right.
And nicotine is the one which is the addicting substance. But as far as the tobacco smoking is concerned, it contains more than 4,000 extra particles, extra chemicals, which are carcinogenic, which cause bronchitis, which cause the heart disease also.
This is, we are talking about the cigarette smoking.
Cigarette. So the what gives kick and the what enjoyment is the nicotine, but with the cigarette you get 4,000 more chemicals which are harmful to health. Now the vaping or electronic cigarette was devised to give safe nicotine inhalation
Uh-huh.
without these 4,000 uh, chemicals, and it should look like and feel like a cigarette. That person smokes like this,
Yeah.
but he doesn't smoke through cigarette, is he smokes through
Through
electronic cigarette.
Right.
So what does it contain? It contains nicotine
Okay.
in a volatile organic compound.
Is it still banned? It's a ban. It's banned in
I'm
India.
coming to that.
Yeah.
So it in a volatile organic compound with our acetylene and other compounds which are flavored, pineapple flavor, this flavor, that flavor. So when you put it on, you take a smoke. So with that, the machine, the battery becomes on, and you get vapor which contains nicotine. Along with that, whatever or a volatile organic substance is there, that also
Goes in.
goes into the lung. So it was also used as a tobacco cessation technique.
Okay.
Cigarette. So soon it was realized that you get an uncontrolled amount of nicotine in your system,
Mm-hmm.
and youngsters started taking it in school and even in the middle school.
Right.
So if you talk about United States, one study was done where 8% of the students were taking
Okay.
vaping. So, but it has so many harmful effects because of this. One, that you don't get rid of addiction. Addiction continues, and these volatile substances, organic substances, they cause bronchitis. They themselves cause bronchitis. They are also carcinogenic,
Okay.
and by virtue of that, you don't get rid of the addiction. The addiction continues.
Okay.
So whenever the electronic cigarette is not available, person will go
Switch
and
on
buy
to
switch
cigarettes.
on the cigarette. So instead of reducing the tobacco smoking, it increases the. So government of India, the Indian Council of Medical Research had constituted a committee under the chairmanship of Dr. Srinath Reddy, of which I was one of the expert members.
Okay.
We came out with the white paper in 2019 detailing about why the electronic cigarette is harmful, and we also recommended that it should be banned by. Thankfully, this white paper was submitted to the Ministry of Health, and Government of India came out with the ordinance,
Okay.
which became a law,
Mm-hmm.
that manufacturing, sale and use of electronic cigarette is banned
in India.
But unfortunately, we all know that it is
Still continuing.
It is available. So what is happening is, although it is used for reducing the harmful substances, now imagine a 14 years, 15-year-old boy
Yeah.
in a party or in a school, he he uses electronic cigarette from a friend or whatever, and he gets hooked to the nicotine. And electronic cigarettes are definitely more expensive than tobacco, and there are so many places where you cannot smoke cigarette. So people use electronic cigarette to get nicotine. That is one aspect of it. Another thing is that these children or the adults or adolescents, they they get addicted to nicotine. So then, because of ease of availability, they start smoking cigarettes.
Cigarette,
So
e-cigarettes,
instead of reducing the
smoking of cigarettes
smoking, it increases the
increases
smoking,
more.
and that is why we recommended to the government of India through this white paper from ICMR that it should be banned, and it is banned. So by banning, you sort of reduce the consumption at least. It's not
That's right.
widely.
Some restrictions are there.
Some
at least.
restrictions are there. Yeah.
So is it really very dangerous than normal cigarette?
Yes, it is. See, the thing is that
Or they can be compared same that.
let me answer that question. Like cigarettes were in World War II, everybody was smoking.
Right.
The Indian movies 1915 and 60s, they were smoking.
Yes.
The hero smokes.
Yeah.
मैं फिक्र को धुएं में उड़ाता चला गया, आपने भी सुना होगा. So the ban on cigarettes came in 1958 when Surgeon General of America,
Okay.
they came out with a report that tobacco smoking is harmful. Now, smoking started centuries before. The harmful effects were recognized centuries later.
Later on.
So, the vaping has started now.
No.
Only decades after this, we will come to know what are the harmful effects. But suffice is to say that it increases the nicotine addiction.
Right.
And there are experiments done on rats that they gave them vaping and then they examined their lungs.
Okay.
So they found that they are carcinogenic.
Okay.
So vaping is also carcinogenic. There are sudden deaths because of vaping. There are incidences of fire in the lung.
Oh.
Because they are volatile substances. So it is actually very harmful, and also the amount of nicotine that you get through vaping is not measurable. One cartridge of electronic cigarette contains nicotine equal to 20 cigarettes.
Okay.
Nicotine contained by 20 cigarettes.
Right.
So it's a very heavy dose of nicotine, so it is more addictive.
Does it give any kick? Like.
Of course, yes.
Okay.
I have not taken it, but
Okay.
I know that it gives a kick.
Okay. Okay. Coming to like the dry tobacco, which is now more prevalent, and a lot of people from children, women,
Yeah.
and men, and all class of people are into dry tobacco. More of users of dry
No,
tobacco.
that is called Kheni.
Yes, Kheni and
Kheni or Gutka.
Pan Parag.
Gutka.
Yeah.
We will not take any brand name.
Right.
So, Kheni or Gutka, they also contain nicotine and they also contain harmful substance, but it is chewed. It does not go directly to lung. So, it is the commonest cause of cancer of oral cavity, the
Okay.
mouth, and also of our voice box, larynx, and also it causes cancer of the food pipe.
But why is it more prevalent in women? Women,
It's a social.
ICMR study has shown that more.
Yes, women, because it's so inexpensive, it is cheap,
Right.
it is widely available, and generally now it has become a fashion. But generally, socially, women do not smoke in public. In
Right.
In the
In the middle class and lower middle class.
In higher class, they
it's a
smoke
fashion.
It's a fashion. Today when I get my patients from that strata, I am really disappointed because majority are smoking when I ask them. So,
Right.
and they don't hide it.
What do you find these days? The men are smoking more, or women are smoking more?
Men are smoking. Relatively men smoke more, but women smoke more in public. They want to show off. We are equal.
right.
So this is what is happening in West. In the Western world, in olden days, the men were smoking more. The lung cancer was seen in men more.
Right.
Now the lung cancer is seen more in women because more women
More
are
women now
smoking.
smoking. Right. Are the lung conditions you see that are specifically linked to environmental exposure?
Lot of them, and both indoor and outdoor environment. You must. I don't know whether you have seen the Chicago study
No, I haven't.
where they say that average lifespan of person living in Delhi is reduced by almost 9 years, and average lifespan of person living in India is reduced by 5.3 years only because of exposure to indoor and outdoor air pollution. So the atmospheric air pollution, both indoor or outdoor, not only causes asthma, COPD, and lung cancer, it causes heart attacks also, hypertension also, it also causes brain stroke also, and all the cancers of the body, including urinary bladder or gastro cancer, ladies breast cancer, uterus cancer, all are enhanced or caused by air pollution. It also causes infertility,
Okay.
both in men and women. And you must have seen IF center all over.
Yes,
Infertility
yes.
is so common. One of the causes is air pollution and tobacco smoking.
Okay, okay. What are the latest advancement in treating pulmonary hypertension?
Pulmonary, pulmonary hypertension is of two types. One is secondary to lung disease, and what probably you are asking is primary pulmonary hypertension. It's not a very common disease, but now we have good drugs, and I need not recite the names of the
Right,
drugs.
right,
The
right.
majority of treatment is by advanced medication, which are quite expensive.
Okay. How does smoking cessation impact lung health, and what support do you offer patients to quit?
So, stopping smoking is the only way to prevent or prolong life of a patient who
Right,
has
right.
COPD. And like air pollution, smoking also causes heart attacks, brain attacks, dementia, and also cancers of every part of the body. So once you quit smoking, then the chances of heart attacks by 10 to 15 years become almost equal to the person who is
Not smoking.
not smoking. Uh, Although the chances of COPD goes down,
Okay.
but they don't become zero.
Mm-hmm.
Even lung cancer chances are also reduced,
Okay.
and everywhere the health would improve if
Okay.
once the
Can you talk about advancement in respiratory therapies like non-invasive ventilation?
yeah that is my subject. That so non-invasive ventilation. I am a critical care physician also,
Right.
pulmonary and critical care physician. So mechanical ventilation is given by putting in a tube in the windpipe, which has several complications. So non-invasive ventilation is being used in critical care starting from 1993, you can say. The first study came at that time
Okay.
from France. So what you do that give artificial ventilation not by putting in a tube, but by using a mask.
Okay.
So the advantage is that you can give pressure and push air into the lungs. But after 1 hour, if the person wants to eat, so he can remove and eat, and then again put the
Okay.
ventilator. So this is very commonly used not only in the ICU, but
Uh-huh.
people are using it at home for even for months and years to support their
The lungs.
ventilation.
Uh-huh.
And most common cause for which non-invasive ventilation is used is COPD.
Okay. Do you see difference in lung health outcomes based on lifestyle or socio-economic factors?
Of course, lifestyle is very important. Avoiding exposure to atmospheric air pollution, both indoor and outdoor, avoiding tobacco smoking are the most important. Besides that, your nourishment, having sufficient amount of protein, fruits is very important. Exercise is very important.
Very important.
And regular exercise, including yoga or pranayam, whatever
But
you want to
what
do.
what we have seen is that when somebody smokes, their cardio is not that up to that limit of a
Yeah,
normal
sure,
person.
sure. So the effect on heart
Yes,
is adverse effect on heart is immediate,
right.
because the carbon monoxide when you smoke goes into the blood
Mm-hmm.
and it affects the heart.
Right.
There is a heart rate increases, the blood vessel changes are there. The moment you quit smoking, within a day your heart rate stabilizes.
Okay.
So that adverse effect of smoking on heart starts improving as soon as you quit smoking. And as I said, after 10 to 15 years, the risk of heart problem becomes as good as of non-smokers. So it is important. Through you, I want to convey to the whosoever is watching this, that tobacco smoking reduces our lifespan by 8 to 10 years average.
Okay.
It's not a question of only reducing the lifespan. People say वो तो ऊपर वाला लिखता है जितनी जिंदगी
But suffering goes, but
लिखी है,
suffering increases.
but it is associated with suffering. So,
Sufferings.
people get what you call as Burgess disease, where they get amputation of their feet and arms because the blood vessels get clogged. People get heart attacks. People get brain stroke when they get paralyzed. When they get COPD, they keep on coughing for rest of their life. Even if they quit smoking,
Right.
the COPD will not revert to normal. And the most common cause of cancer death
Mm-hmm.
all over the world is lung cancer,
Right.
not other cancer. Lung
Lung
cancer is
cancer.
number one cause of.
The oral cancer and lung cancer are the.
No, lung cancer is the number one cause of death,
Okay.
because usually the detection is late and outcome is very poor. The
Okay.
death rate is very high. So, an only way to prevent lung cancer is to avoid exposure to
And what are the
tobacco.
symptoms of lung cancer? Like, how can somebody detect that he is going through this lung cancer?
So, lung cancer has very vague symptoms like cough.
Uh-huh. Like you said, in morning cough.
No, not that's not a sign of lung cancer. That is
Okay.
a sign of COPD.
Okay.
Lung cancer sign is a patient develops a new onset cough,
Mm-hmm.
usually is not associated with fever, and chest pain and hemoptysis,
Okay.
bringing out blood with the cough.
Okay.
These are the main
The
cardinal
early symptoms of lung cancer.
cardinal features of lung.
Okay. Okay. How do you console a patient with chronic lung disease on managing their condition daily?
So we tell them that lifestyle modification, the medicines which are prescribed to them, regular exercise, physiotherapy, especially the breathing exercise, and the diet.
Okay.
And one important aspect that we have not discussed, that now that we have vaccinations for preventing lung infection. There are two
Okay.
main vaccinations which are recommended. One is for pneumonia,
Okay.
other is for flu. And these are the two main infections which affect all of us. These vaccines are given to people who are more than 60 years of age,
Okay.
or who have got some lung
To the
disease.
general patients.
To general patients,
Okay.
everybody above 60 years of
Right.
age, and also the patients who have lung disease like asthma or COPD or
Right.
interstitial lung disease. They are also given to people who have diabetes, or whose immunity is low for whatever reason, maybe for cancer, or they are undergoing chemotherapy. So there are recommendations for these two vaccines. The influenza vaccine is taken every year,
Okay.
once a year, and pneumonia vaccine has different schedules. Usually it is given every 5 years.
Okay, how important is patients' education in pulmonary care?
It is extremely important to educate the people about their lung health. Now, we have not talked much about asthma, which is 5 to 10% of the world population
Right.
has asthma, and asthma can be as common. Like New Zealand, the asthma prevalence is 29% of the population.
In New Zealand.
Yes.
Oh, that's
So almost one third patients have asthma. So even
shocking.
India also, 5 to 10% of population start, even in the young children, they have asthma. So for asthma patient, it is important to realize that any patient who is labeled asthma can achieve anything. Like he can be a sportsman, he can be a cricketer, like Botham, who was
Right.
a football player, or PT Usha. They are all asthmatics.
Right. Right.
And in 1988, 10% of Olympic medalists were asthmatics.
Okay.
But they were well managed by proper diagnosis, proper treatment. So trigger avoidance. The commonest trigger for asthma are the house dust and pollens and viral infections. So if you know your triggers as to, and pets at home, people
Okay, that
keep
is also
pets.
one reason.
That is also one reason.
So
So if
any pet or specific pets are there, like
cats,
cat, dog, birds,
cats and dogs.
dogs.
Cats more than dogs. Uh, they tend to trigger the. So it is important. Patient education is very important
Okay.
to know their triggers and how to use inhalers. People now it is not there, but when I started practicing, the moment I said please take inhalers, they said no, this is addicting
Right.
and it is a stigma. People don't want to use inhalers. But now it's not there. People are very happy to take inhaler because that is the best way of treating asthma and COPD.
But it's very shocking that New Zealand is having more cases of asthma because
No, there are
people are
reasons
thinking
for
that
there are
asthma is like
no,
in a
it's not.
polluted place or it is
No,
related to air pollution.
there are various reasons for that. There are hypotheses for that. So we need not discuss in this
Okay.
forum.
Yeah.
But just to emphasize on you that in world that asthma incidence is as high as 29%.
Okay. As you are very expert in, you know, medicating sleep disorder, how do you say, like, how should somebody mitigate the sleep disorder?
So sleep disorders are mainly two. One is insomnia, which
Right.
is very common these days. We all keep using, you know, our mobile phone, television, laptop till
Right.
late in the night, and then we want to sleep. Then the sleep doesn't come,
Right.
and we kill our sleep by following a erratic routine. So insomnia is one problem. Another common thing which is occurs in is called sleep disordered breathing, what is called obstructive sleep apnea or sleep apnea. This more often occurs in people who are overweight, but
Okay.
not necessarily in own 30% of sleep apnea occurs in normal weight person also. These are the people who usually snore a lot,
Okay.
and with the snoring, their
The breathing.
breathing is irregular
Right.
because snoring means can make a sound only when you make a passage narrow. If you want to whistle,
Yes.
you have to make the bottle narrow and then whistle.
Then.
So similarly, when the sleep becomes deeper, our muscles get relaxed, and those who have narrow airways, their muscles further become the opening becomes narrow, and you start snoring.
Right.
With the snoring means that airflow slows down
Right.
because there is rukawat,
Right.
there is a blockage, and ultimately it stops.
Right.
What is called as apnea. With that, oxygen goes down, and if somebody puts more, you know, stops my breath, and I'm sleeping, I'll wake up.
Yeah, exactly.
Guttan hogi, I'll wake up.
Yes.
So this waking up occurs at a subconscious level.
Okay.
and it happens several times in an hour.
Okay.
Sometimes
This
even
you're talking about acute sleep disorder, or this is
chronic
chronic?
chronic sleep. So when with the snoring, the breathing keeps slowing down and stops, and there is what is called as arousal. Patient keeps waking up at a subconscious level. He doesn't know that he
No.
is waking up.
Okay.
So we
Because he's
need,
not breathing properly.
because of the stoppage of or slowing down of breathing. So when he wakes up in the morning, he is groggy. He although after sleeping 6 to 8 hours, his
Still
sleep
not.
is not refreshing.
Right.
He wants a cup of tea, he wants a cup of coffee to keep awake. Some people get up and smoke. In the daytime, what we call as daytime sleepiness,
Mm-hmm.
somnolence, though he sleeps while in office or when he is in a meeting or sitting in the car or while driving. The most common cause of car crashes in America is sleep apnea.
Sleep disorder.
So, because of this breathing slowing down and oxygen goes down several times. One, that it affects life because they are not able to function
Also
properly.
properly.
There is also scientific evidence that there is more hypertension,
When you don't sleep
more
properly.
heart disease,
Okay.
more strokes, more strokes, brain strokes in patients who have sleep apnea. So it is diagnosed by a test called sleep study or polysomnography, where we test their sleep pattern, eye movement, and their oxygen, their airflow, and their sleep quality by doing electroencephalogram. So 12 parameters are monitored
Okay.
to give a diagnosis of sleep apnea.
So these days you find that to combat this sleep order, you have so much medicines in the market. Ayurved medicines have pills.
So I have no knowledge
Then
about that.
magnesium. If you use magnesium, you get a proper sleep.
All these are gimmicks.
It is not
I am not talking
truth.
about Ayurveda, but
Hmm.
other tablets do not work. The treatment of sleep apnea is done by lifestyle modification, like if the
Naturally, it's been done
person
naturally.
reduces weight by 10 kilos, 15 kilos, depending upon quite a bit of it will be. The other, there are three treatments for sleep apnea. One, that you give a mask that you call non-invasive ventilation. It is given by CPAP, continuous positive airway pressure.
Okay.
It's a pneumatic splint. Because of the pressure,
Uh-huh.
it keeps the airways patent. So person
Okay.
does not snore, the airflow becomes normal, and snoring stops.
But is he okay with that thing
So
putting in his
our
mouth for the whole
patients,
night?
it's usually put on the nose only,
Okay.
not on the mouth. Only unless the person is mouth breather.
And the sleep disorder is there in kids,
It
middle
can
age, and
occur in it can
senior
so
citizens. In
yeah.
all age group, it is there.
Usually it is more in the middle and past middle age, but it can occur in children also, because children obesity is now very
More
common.
increasing day by day more.
So other treatment is by surgery. Somebody who have big tonsils
Okay.
or nasal obstruction or some polyps are there. So surgery can be performed to open the airways. And third is which I have no experience is put dentists make appliances which brings your mandible ahead, जबड़ा आगे
Uh-huh.
हो जाता है,
Okay.
उससे breathing better हो जाती है. But
Okay.
that is only can use for mild cases, not for moderate cases.
Okay. Thank you, Dr. Khilnani. This is all for from now. Thank you, HOA.